commemorate certainly the lives lost. We still feel that in our healthcare system, team members of ours, team members in other healthcare systems have been lost, and it's just such a tragedy. 997 in this county, over 1 million in the United States, globally, untold numbers, which has been really, really hard. Thanks to our county commissioners, thanks to the mayor, local political and operations leaders do all this work that so many people don't even acknowledge or know is happening to keep them safe. Joshua, you and your team, phenomenal job, phenomenal partners in all of this. I want to thank our community members who lined up to get vaccinated, who wore masks, who were separated from their places of worship and their schools and all those things, because we didn't know exactly how this was going to go, and the science was evolving, and we had to message that. They were really hard times for those places, and some of those people still haven't gone back. They're watching their worship services online, and there's still a lot of fear for a lot of people, and I really feel for them. I want to thank our media partners. They've done an incredible job of asking hard questions about response to the pandemic, but also putting out accurate information so that our public knew what to do, what was the next thing, were vaccines available, do I wear a mask, do I not wear a mask, where can I go, what's the best way to do that. I saw recently, I asked our HR team, I said, hey, can you give me a little statistics on kind of what media had done in the 3 years? And they said, you've been quoted in over 1,300 articles. And I was like, well, two things. One is I should have been charging by the article, which I was not doing, and that was a great mistake on my part, and also just the importance of the media relationship. And really appreciate that and the weekly press conferences we did and all of those things. I want to thank our other partners in other healthcare systems, clinics, and in ICUs, and in hospitals, and they lined up to test people in parking lots when it was 100 degrees and when it was 20 degrees. They opened vaccine centers. And there was great risk to them, physically, mentally, emotionally, spiritually, all of that. And they haven't all recovered. Really hard things. Relationships were torn within families, and we're coming out of that. So they are my heroes and always will be. I'm very indebted to the work they did. You know, it's one thing for me to go on television, be the face of it, but they really were doing the work. It was an honor to represent them, and it's an honor to represent them here today. And I'll just finish by saying, and it was alluded to earlier, we saw what could happen when healthcare systems work together with public health and our political leaders, and we're all pulling the rope in the same direction, and when awesome things can really happen. We need to continue to do that. We have other issues, other big issues that are much more, are also endemic and have been here much longer than 3 years that we can really partner with and work on. So I would encourage us to continue to do that, and thanks for letting me make a few comments today.